Now let's talk about how posture affects the way we look. What are your thoughts on that?
Well, I have a lot of thoughts on that because it's just another adaptation of our body. So let's draw a picture. Let's imagine somebody slowly but surely is developing the slouchy posture. We'll just make it simple. You know, that one of those what we call it anterior head carriage, right? When somebody, I'll make it simple, when somebody's walking around like this. Mm-hmm. And that's probably 50% of population. Or somebody is locked into, you know, that's the second biggest problem our technology these days. You walk the streets and pretty much nobody's looking straight. Everybody's looking down.
Yeah.
And looking down at their smartphones, at, other devices and gadgets. It's a huge problem, not only for the spine. For the spine, to explain for the spine, it's very simple. Our head weighs on average 10 pounds, 10 to 12 pounds. As soon as you bring, and that's distributed, that weight distributed on 7 discs, meaning in between vertebrae, we have these little cushions, and they cushion that, they diffuse the weight of the head.
Right.
Now, as soon as you shift it forward, that brings that weight of the head transferred to only 2 to 3 vertebral discs. Now, most of them are not active because they're not holding the weight.
Right.
And now it's equivalent to about 20 pounds of weight falling in those discs. And when you see the guy literally just walking down and reading or looking at their phone, that's about 30 to 35 pounds of weight falling onto 1 to 2 discs. What do you think is going to happen to those discs? They're going to disintegrate and break down extremely fast. Yeah. So today we have one of the biggest, fastest developing problem. We have a disc herniations or degenerative breakdown of the cervical disc or neck disc in much younger age than ever before. I'm in practice for 22 years. I do not remember seeing so many young people coming in not only with neck problems, but it's already with significant damages to neck discs and neck structures and muscles without any history of trauma. So definitely something to think about.
Yeah.
It's much easier to prevent than to treat. Sooner or later, the further it gets, the harder it gets to treat.
Yeah.
And you spend it's a lot of pain, a lot of aggravation. If you're lucky to find a good doctor, it's a long treatment or it's a surgery.
Are there warning signs for that, by the way? Or it's just like one day, something snaps and you go and you are told that, oh, you have these badly herniated discs or messed up discs?
It's different. People are not super alerted with the mild aches and pains. And, you might get a little headache, you might get a little muscle ache. For most of the people, it's a very slow process of developing this problem. Right. Your body adapts really well. So until it really starts breaking the fibers of the disc itself, the outer ring, they'll call annulus, right? Or the ring that holds the gel together, because it looks like a layered net. It's net over net over net. So those layers of net starts breaking apart. And as it breaks apart, cracks apart, the gel starts protruding out. So the more layers you break, the more inflammation we develop there. Therefore, the more pain we start getting, and sooner or later, when it breaks through, it starts pushing your nerve, and that's when we develop a really full-blown problem.
Okay.
So going back to aesthetics of it, now imagine the head is, I wouldn't say looking forward, but just popping forward.
Yeah.
Now, the musculature, adaptation of the muscles that's supposed to support your head not being supported by discs is very significant. So the muscles that are supposed to do just a simple, let's say, flexion of the head or a little lateral flexion or rotation of the head, all of a sudden they have to support you. So all of a sudden those muscles are constantly tight and pulling down on your jaw, they're pulling down on the upper neck muscles, or the upper neck vertebrae. Therefore, it starts sinking your whole face and your whole jaw forward. People developing TMJ problem, the jaw problem, the joint that connects the upper and lower part of the jaw. People are developing vocal problem. I actually treat a lot of singers that the deeper cervical muscles, the deeper muscles of the neck, because of this poor posture again, had been pulling the vocal box sideways, and by creating that rotation, they actually mispositioning the vocal cords. So now they overloading one side and underloading another. They actually losing their voice significantly earlier. I just had a whole group of singers being treated right before the coronavirus started, specifically for that problem, opera singers. So we see all these changes. And of course, on skin and the muscles that are supporting that elevating the face, it will create the same toll. So yes, all the jaw muscles that creating our nice cut of the face start sinking down, right? They're being stretched out, they're being pulled. They overloaded because now the jaw, you have to chew, and when you have to chew with the jaw protruded forward, just because your neck sits this way, it will in fact start leaving the toll on the muscles of the face. Yeah. Because you utilize all these muscles of the lips, the muscles of the chin, as well as the muscles that coming down. So will it be affected? Significant, very significant. I think it's not just a matter of aging and losing collagen and perhaps feeling that the skin is no longer elastic and no longer kind of like comes back to its proper shape. No, it's about the muscles. I think most of it, and you're a specialist in that, but I think most of the changes, if you want to create long-term changes for people that are desired to have a younger look, it's all about recorrecting the muscles.
No, it's true. I mean, I think this is such an important point because we know, so in surgery for like a facelift, the modern way to do a facelift is to get at what's called the SMAS, which is the muscle system in not just in the face, but also in the neck. It all connects. Like the platysma is just the inferior, connection and continuity of the SMAS that's in the face. It's all one system. So when you go in surgically, you're essentially lifting all of this together. And that's why people get confused. Is it lower face lift? Is it a neck lift? It's all the same thing. It's all done in unison. So exactly what you're saying, but at the root of it, at the core, is essentially a system of muscles. Yeah, and I never really thought about it this way, that, the way that our head is sitting on our neck and how it's aligned with the vertebra and this kind of downward pull, even, to the platysma muscle, could definitely pull sort of the mid-face and the lower face down with it. And also I've noticed some patients have pretty significant horizontal bands on their necks. And so I'm thinking, maybe getting their posture corrected could help them with that, because that's a difficult problem to fix other than, if you do the facelift, but then still sometimes can't get rid of the lines completely. And then Botox and filler is kind of useless in those. So you just tell them there aren't any great solutions. But it just kind of, I think it opens up my mind to all the other possibilities. And I think the other kind of thought I had was, when you do a facelift, you tell someone, well, it's not going to be there forever. You're going to continue to age. It's going to droop eventually, right? If it's a good facelift, it can last, 10 years. But what if we did a facelift and then once they're done with their recovery period, send them to an expert like yourself to really align things properly so that maybe that drop, that inferior sag, would get delayed over an even longer period of time. That's something no one ever talks about in our field, my field.
And I think for younger people that are coming to you in search of the solutions to stay younger for a longer period of time, and we often hear that, well, the earlier you start doing Botox, the less wrinkles you're going to create in your face towards the older age. And, it's true, it has its value because it does relaxes the muscles. But really trying to, in a prevention mode, trying to reposition your posture, correct your posture and allow the muscles to stop overworking and start kind of doing what they're meant to do, the normal function. We're also preventing these overuse or deterioration of the muscles that are otherwise would be, in that sagging position, just because, what sags? Something that doesn't work, right? The muscle is toned because the muscle is doing its job. It's rarely sagging. Yeah. What we're getting sagged, for example, we're getting some people getting the stomach getting sagged, right? Often it's not just the fat. Often it's very inactive musculature that's supposed to create a proper support. Mm-hmm. So I believe the same thing is happening in our face. If there's a certain group of muscles that does the job for 3 other groups that are just not working, it's going to be constantly spasm. It's going to create other issues. But the muscles that are not working, that's the muscle that just atrophies and either sags or becomes or just disappears. And that also changes the way we look. So yes, absolutely important. Similar talk with one of our other surgeons in the office, Dr. Sophie, who specialized in mommy makeovers. And we've been discussing how trying to engage the muscles of the core when the muscles was distended or damaged, it's almost impossible.
Right.
So the same thing I want to say here, if we already have this sag down muscle that lost its fibers or the position that the way it's supposed to work, sometimes lifting it up actually can help us to reboost the postural correction. So again, there's always, interlocking of those things together, just because one thing follows another.